Well, I don't think it should have any impact on the care we provide, because our commitment is to provide excellent and superior and patient-focused care regardless of what the reimbursement is. And this is primarily, from our perspective, significant insurance reform in addition to healthcare reform. Yes, it will have an impact on us because as more individuals are insured, currently our percentage of uninsured patients that we take care of at our hospital, it approximates between 10 and 12%. For us, that's in the neighborhood of $12 million of uncompensated care that we deliver to our community annually. And we believe that with more individuals being insured, that will be reduced. Now, we also recognize that the reform bill, one of the ways that it will pay for that is by reducing what we're paid for Medicare patients in some instances. But, you know, from a hospital perspective and from Adventist Health System or parent corporation's perspective, we're very clear that there is a need for the reform of our healthcare system. Regardless of all the rhetoric, we have been on an unsustainable trajectory of the percentage of our gross domestic product that healthcare is. So we need to reform the way that we pay for healthcare, the fact that a significant portion of our citizens have no coverage, and this bill does accomplish many positive things. We also believe in the importance of public and private partnerships. We're not fans of a sweeping government takeover because we believe that there are many positive things that the private sector can bring to the table in collaboration with the federal government to make this beneficial. So we are supportive of healthcare reform, and we believe this is a good start in achieving a more sustainable model of healthcare delivery and payment. From a long-term perspective, and I'm not ever going to try to predict what Congress is going to do, you know, but I think, as I said, this is a lengthy journey, and I see this as a significant first step in that journey, but the legislative process, we need to provide our input into that process as we speak with our state representatives and senators to let them know the pieces that we see many positive things in, and then the pieces that need refining. I mean, for example, I believe that greater emphasis should have been placed in the area of wellness and prevention. One of the pieces of the bill allows up to, I think, a 30% discount for employers to offer to their employees and employer-sponsored plans who participate in wellness initiatives. You know, it all starts with healthy lifestyles and appropriate prevention and incentivizing people to be healthy. So I think that part can become more robust in rewarding appropriate choices and behavior. You know, as we look at some of these provisions, I mean, they do not go into effect until 2018. How practical really is that? So some, I believe, need to be online a bit earlier, and I am thankful that provisions such as allowing children to stay on their parents' plans until the age of 26, or just the entire debate of pre-existing conditions, that those things are being addressed early on, because I think they have a significant impact on people's willingness to access health care or to obtain health care insurance. You know, I'm the eternal optimist, and obviously the enrollment in medical school, or the applications to medical school, are not at the level we'd like them to be for an aging population. I think that what we will see as a result of this is the more extensive use of physician extenders, nurse practitioners, physician assistants, so that they can take care of the less acute medical problems and the doctors can focus on the more acute medical problems. And just a recognition that, you know, as Americans, we all have infinite expectations, but we have finite resources. And what's the best way to utilize our finite resources?